Honorable delegates, we are so lucky that this afternoon we also have with us Dr. Judith Kose, who is the director for Elizabeth Glaser Pediatric AIDS Foundation. From the presentations, it is very clear that there's a link between tuberculosis and HIV. And we heard from Honorable Minister from Burundi, who said they have even integrated these services of TB and HIV. Now, from you, Dr. Kose, you have so much experience in especially HIV, AIDS, but I can also imagine in TB from the countries, so many countries where you have worked. What is it that we need to do to accelerate this idea which we have that by the year 2030 we should have a TB-free generation? From the discussions, from the presentations which you have heard this afternoon. Thank you.
Thank you, Honorable Minister and Moderator, for that question. I think, as has been said during this panel meeting, childhood TB, while it is a preventable and treatable disease, remains a condition poorly addressed by global public health agenda and often has been neglected by health policymakers and TB control programs. And as Dr. Gesana mentioned, majority of the children with TB remain undiagnosed and untreated. We, the Elizabeth Glaser Pediatric AIDS Foundation, carried out a national policy landscape assessment and country preparedness for childhood TB in 2018, and we had a repeat in 2021 in 10 countries. 9 of these 10 countries were in Africa, including Cameroon, Cote d'Ivoire, DRC, Kenya, Lesotho, Malawi, Tanzania, Uganda, and Zimbabwe. And the 10th country was India, which we know has a high TB burden. The purpose of this assessment in 2021 was to evaluate the progress made by countries over the 3 years of supporting pediatric TB work and identify areas that need sustained effort to improve childhood TB diagnosis and treatment. And from this assessment, we proposed a number of recommendations to bridge the gap. And it's from this assessment and our experience that I want to highlight just a few areas that can be focused on to accelerate the progress, Madam Chair. The first is to scale up systematic TB screening at relevant child health entry points with appropriate active case-finding strategies among children and adolescents. And I think the Honorable Minister from Burundi alluded to this. An active case-finding strategy is really the cornerstone for the TB cascade of care and the only way to ensure early diagnosis and treatment. To achieve this scale-up of systematic TB screening, countries must, 1, recommend the use of child-adapted symptom-based screening, including signs and symptoms that are characteristic of pediatric TB, and where possible, ensure the inclusion of chest X-ray to support identification of children with presumptive TB. Countries must also ensure that the IMCI policies and guidelines are up to date and include TB screening algorithms for the appropriate recognition and management of TB in the context of child health. There's also need for countries to commit to translating policies and recommendations on active case finding into practice so that from the policies, they actually go into practice. The second recommendation I want to highlight, and this has been mentioned in this panel, is to speed up the integration of TB services into other health services, including nutrition. Lack of integration of TB services for children and adolescents into other services, such as PMTCT, maternal, neonatal, and child health, nutrition, and outpatient, is a missed opportunity to timely detect children with TB and put them on appropriate treatment. To achieve this integration, country must, 1, ensure the continuum of care for TB in children across all services. They need to adapt national policies to include other aspects of integration beyond just TB screening and include things like diagnosis, treatment, prevention, and follow-up in these other areas, including appropriate model of care for specific setting. and ensure particular attention to case detection and prevention in the nutrition services. And from our work, we have evidence that integration of pediatric TB screening in the non-TB entry points is feasible and has improved identification of pediatric presumptive TB cases and subsequently increased TB detection. The other area, Madam Chair, I want to highlight for accelerated services is for countries to adopt a comprehensive approach for pediatric TB diagnosis, including clinical assessment, radiological assessment, and the use of the WHO recommended diagnostic assays whenever possible. There's a huge gap in TB diagnosis among adolescents and children, as has been said, and there's really no treatment without diagnosis. To adopt this a comprehensive approach, country needs to quickly adopt policies and recommendations on the use of the WHO recommended diagnostic tools for TB diagnosis. Countries need to prioritize the use of expert as a first tool for diagnosis, while rapidly supporting the adoption of the expert ultra and improve the use and access to quality chest X-ray, and also ensure that there are guidance and support to use the recommended TB sample collection and interpretation of chest X-ray is available, including training. From our work, we have evidence that implementation of sample collection procedures, and I think the Honorable Minister for Burundi mentioned this, when you improve the sample collection procedure, there is significant improving in the identification of children under 5 years old with bacteriological confirmed TB. Additionally, we have evidence that improving the use of chest X-ray for diagnosis for TB, including the use of telemedicine to translate the chest X-ray, and training of nurses and doctors on chest X-ray interpretation leads to increased identification and final diagnosis. I think the other thing I want to highlight is to ensure availability and use of the child-friendly formulations for TB medicine for children, as well as, the use of TPT regimens has been mentioned. I think we now have the new WHO guidelines, including the one for 4-month regimen for treatment. So countries really need to adopt these new policies to enable the use and accelerated methods for diagnosis and treatment for TB in children. Thank you.